Hello all, my name is Dr. Vishruth Keraj, consultant urologist, andrologist and uro-oncologist at Bangalore Hospital, Kengeri. So today I would like to take a few minutes of your time to talk about something very common, a very common urological problem, which is urinary tract infections. So firstly, let's start with how common are urinary tract infections. As most of you would know, urinary tract infections are extremely common, even more so in females. In fact, every woman would have experienced at least one episode of urinary tract infection sometime during their lives. In men, the chances of developing urinary tract infection are a little on the lesser side, but as men age, because of various problems like prostate enlargement, they can have a higher incidence of having urinary tract infections. So what are the symptoms of urinary tract infections? Most commonly, urinary tract infections, let's call them UTIs from now. UTIs will present with some burning sensation in the urine, maybe some blood in the urine, some vague discomfort or pain in the lower abdomen, vague back pains, even fever and chills or shivering. These are the most common symptoms. Rarely patients can also have vomiting. So what are the tests done for urinary tract infections? Many times urinary tract infections will not have any underlying cause, there will be mild. In other situations, urinary tract infections will have some or the other underlying cause. So to know what the cause is, we have to run a bunch of tests. These are very standard routine tests which are usually done. They are urine test, blood test, and many times an ultrasound scan will have to be done to find out whether the urinary tract infection is occurring in isolation or there is some cause for the urinary tract infection. So last part is what are the treatment options for urinary tract infections. So generally, like I said, if there is no cause for a urinary tract infection, the treatment remains mainly symptomatic. We don't tend to use too many antibiotics for a low grade uncomplicated urinary tract infection. We treat the patient's symptoms, which can be burning sensation in the urine or back pain, abdominal pain or fever, by giving the appropriate tablets. But however, while during our investigations, we find that the urinary tract infection is caused by a particular pathology. For example, the most common cause of urinary tract infections in both men and women can be stones. Kidney stones, stones in the kidney tube, stones in the bladder. All these can cause urinary tract infections. The next most common one is the bladder not emptying properly because of a narrowing of the urinary passage. This can occur both in men and women, and if the bladder doesn't empty properly, there is always a risk of urinary tract infections. There can be other rarer causes like tuberculosis and interstitial cystitis, which can also present like a urinary tract infection. With our investigations, we rule out all these things and then we try to treat the cause appropriately. So, like to summarize what we just heard, urinary tract infections are extremely common. However, very rarely are they anything serious. If there is no cause, treatment is symptomatic. If there is a cause, then that cause has to be treated. No matter what kind of urinary tract infection you have, we are always there to help you. I'm Dr. Vishruth from the Department of Urology at Bangalore Hospital, Kengeri. We look forward to helping you deal with any kind of urinary tract infection. Thank you.